Hello, I'm Dr. Meera Mohan with the Medical College of Wisconsin. One of the common questions that we hear our patients ask is, can bispecific antibody therapy, which are very effective therapy that we have currently approved for myeloma, can it be given for a finite or a limited duration? So we looked into this particular question in this study of 720 patients. So among 720 patients, we identified patients who received a bispecific antibody but then came off treatment for reasons other than disease progression. They also were able to have ongoing remission that lasted for at least 3 months or so. So what we found that indeed a subset of patients, really 10% of our patients were able to maintain ongoing remission after a limited duration of bispecific antibody. In the study, we found that this approach might be particularly helpful in patients who do not have extramedullary disease, who are getting treated with bispecific antibody earlier on in their disease course, and in patients who've had excellent response to bispecific antibody prior to discontinuing treatment. So these are some of the factors that help us identify a potential patient who could receive bispecific antibody for a limited duration before coming off therapy and being off therapy. Another important consideration when our patients are treated with bispecific antibody is the risk of infection. We know that bispecific antibodies, particularly those targeting BCMA like teclistamab, elranatamab, linvoseltamab, which is the current FDA-approved products, they are associated with a higher risk of serious infections. So we wanted to understand, by giving bispecific antibody for a limited duration of therapy, and if the patients come off therapy, can the risk of infection improve with time? Indeed, we found that 2.5 years or so after treatment discontinuation, the risk of infection steadily goes down, and there were no reports of serious infection. So it does take an extended period of time for the risk of infection to come down, but then it does come down, which is unlike what we see when the patients are on ongoing therapy, where the risk of infection persists throughout the duration of therapy. Another important question for our patients is, how long do they have to be on IVIG supplementation once they are on bispecific antibody? We know that bispecific antibody is associated with dramatic drop in your IgG levels, which can predispose to infection. So in the study, we found that every month of therapy, the IgG levels go up by 13 points. It's a very slow, but then there's a steady improvement with increasing time of therapy. So we found that, again, it takes about 2.5 years or so following treatment discontinuation. And eventually, we see that less and less patients require IVIG supplementation. And this is important because currently, when our patients come off bispecific antibodies, sometimes there's a practice to stop the IVIG supplementation. But we want to stress that the IgG level does not return back to normal. It takes time, and it's important to keep going with the IVIG supplementation for an extended period of time. So we specifically also looked into relapse-free survival. That means once the patients come off therapy, how long can they remain without evidence of disease relapse? So the 24-month relapse-free survival, that was about 68%. That means 68% of our patients at the 2-year mark did not have evidence of disease relapse after receiving bispecific antibody for a finite duration. Another important question is, can we treat our patients by reintroducing the drug or rechallenging with the same drug after a treatment interval? So in this particular series, there were a minority of patients who did receive the same drug, but then we don't have adequate follow-up to tell us that, how the responses are. But this is something that needs to be investigated further, hopefully in a clinical trial setting.